thrilling to see everyone here. Some old faces, some new faces, somebody who came long back, somebody has come now. And this time, like as you know, the TR Lounge, we launched it almost about now this is 5th month. And every month we are covering up different topics of public interest. Certain topics where we feel that these are neglected areas, where there are chances of things going little bit haywire, so we try to touch those topics. So in continuity, we have this time tempero-mandibular joint. So this is the tempero-mandibular joint, and this joint was my interest mainly was, I see cases coming up with neck pains, and when they come with the neck pains, there are some cases where the neck pain is a consequence of TMJ disorder. Now when they are coming, like one patient we had, we'll do the treatment, everything is fine, go back home, again next day come back with the same pain, we do the treatment, all good, go back next day again with the same pain. So 3-4 din for 3-4 days this was happening, and I was wondering what it is. Then I said, okay, let me check, and I was shocked. The TMJ is totally out of coordination. Then I said, okay, you need to go and see the dentist. Went, splint dala, there's a specific TMJ splint. The splint was put, and after the splint put, 3rd day the patient comes and says, I have no pain now. So these things do happen. There are certain times where these pains, when they go through the dental procedures, a lot of times the mouth remains open for a long time, and they come up with the jaw pains, and then that leads to the pain in the ear or the neck and all. So again, that is like procedure related. Sometimes it may be just like that. We have the expert on the subject. She is dentist, Dr. Sailakshmi. Dr. Sailakshmi is into clinical practice since last 30 years. She has a practice in Anna Nagar, passed out from Annamalai University. Till date, she has almost around, say, more than 15,000 patients seen by her. All my TMJ patients I send to her, because I find her work much more better, in the sense of if it is required, if it's required, if it's not required, not required. Again, TMJ splints, multiple varieties are there. She goes for a simple one. She doesn't strain the things too much. She doesn't exaggerate them to the extent like ye hai, wo hai, nothing like that. So I find her practice. Even my family, any procedures, dentistry procedures to be done, I go to her. As far as TMJs are concerned, I send all my cases to her. So I thought she's the right person who can talk on the subject. Here to you, Sailakshmi, please.
Hello. Good evening, all. So I am Dr. Sailakshmi. I am a general dentist practicing for more than 30 years, and I was working as a consultant dental surgeon in Railway Hospital for 10 years, and I have also been a faculty member in Raga's Dental College for almost 15 years. And coming back to say, my acquaintance with Dr. Alpana has been more than 20-25 years. As you all, I too landed up in her spine rehab center, which was then at Ananagar, with pain in my cervical and my lumbar regions. And it was she, with her very efficient manipulating techniques, she completely resolved my issues. Till date, I keep following what all she's told me, the head and neck strengthening exercises and the lumbar exercises, which has kept me moving on so long. So I thank you, Alpana, for that. And today I've come here to just talk about this tempero-mandibular joint. So what is a joint? A joint is a junction of two bones. So this tempero-mandibular joint, it is situated here, that is in front of the ear. It is, see this joint, this lower jaw or the mandible gets connected with the skull. So, this is called as the tempero-mandibular joint. This tempero-mandibular joint is one of the most complex joints in our body. Why? Because it has a lot of muscular attachments to it. Say from the facial muscles, the muscles which help in mastication, and muscles from the neck head and shoulders all get attached to this joint. See, when the joint and the muscles work in harmony, all the functions like our day-to-day activities like eating, chewing, swallowing, talking, smiling, yawning, all these functions go very smoothly. But when this joint gets inflamed, because these muscles attached to the joint, they also slowly get inflamed and become stiff or go into muscular spasms. So when these problem arises in this joint, then several factors contribute to a condition called as tempero-mandibular joint disorders, TMDs. Okay, so this TM joint disorders, it can occur at any age, but it is most prevalently seen between 20 to 40 years of age and more predominant in women than men. As we all know, of course, because women take up a lot of tension, stress from home and from the other various external conditions. Okay. According to the dental and craniofacial research, it classifies these tempero-mandibular disorders into three categories. One is myofascial pain. Second is internal derangement or internal displacement of the joint or the disc, which comes from any blow injury or any road traffic accident. When the joint gets displaced, so this problem arises. Third, when there is any predisposing degenerative conditions like rheumatoid arthritis, osteoarthritis. See, as these conditions affect the other joints of the body, it can also affect this TM joint. Okay, so the causes of this TM joint disorders. The causes is mostly, in many cases, it is not very clear, but it is very essential to identify the predisposing factor and the contributing factor which causes this disorder. So we have to evaluate step by step, getting the history from the patients, perfect history from the patients, when and see how the pain starts, then how the pain proceeds. And the main cause of this tempero-mandibular disorder is excessive strain of the muscles attached to this joint. How do these muscles get overstrained? That is, most of us have these habits like clenching of teeth or grinding of teeth. During night time it's more, but some of us, when we are so engrossed in our day-to-day work, without our knowledge, we tend to clench our teeth. So that is the foremost cause of this disorder. Second, improper posture during at the workplaces. Third, some patients do have the habit of biting. Say, might be your children or your grandchildren, they might have the habits of biting any objects like pencil, pen, or some sort of biting. So this causes pressure to the muscles, and these muscles tend to get strained. And lot of patients using chewing gums, trying to use the chewing gums for a longer period of time, as well as like biting eyes and all that. So these are all the causes which causes excessive strain to the muscles attached to this joint. So see, as long as these both are in harmony, all these functions go smoothly. And this myofascial pain. What is myofascial pain? Myo means muscle. So this myofascial pain is the pain associated with the facial muscles attached to this jaw, as well as the muscles, the muscular attachment from the neck and the shoulder to this joint. So and the other main reason why we get this myofascial pain is main 90% due to this clenching or grinding of teeth, which is called as bruxism. This is a habitual, involuntary condition. And so how do we go treating this bruxism, or how to approach this? First, let us know about the signs and symptoms associated with this condition. The primary sign which the patient can feel is waking up with a dull, gnawing pain in and around this joint. Okay. Second, they might have waking up with this pain. Then they might have frequent headaches and migraines, and some patients do have pain from behind the eyeballs, which radiate to the neck, shoulder and back. And there might be also pain in the ear or this ringing in the ear without any acute ear infections. And dentally, patients can have hypersensitivity of the teeth without any dental issues, without any dental caries, without any dental issues. They might have this hypersensitivity of the teeth. So how do we manage this? So the main cause of this bruxism, clenching or this grinding of the teeth, it is because of various factors. One, because of stress. Second, psychological conditions like depression and anxiety. And so we have to first find out what are the factors which is causing this from the patient by thoroughly examining the patient and getting to know about the perfect complete history from the patient. Only then it is very helpful to manage this condition. So normally this joint, when we sleep, this joint has to be maintained at complete rest position. But when we tend to clench or bite our teeth or grind the teeth, what we do, excessive masticatory stress is distributed to the joints. So the joints get inflamed. When these joints get inflamed, the muscles attached to it, slowly they also go into soreness, they become fatigue because of this pain. So how do we manage it? How do we manage this condition? First, we have to educate the patient of maintaining the correct posture. Be it either working in the kitchen or working at the workplace, they should maintain the correct posture. Second, by applying frequent ice packs or hot pack. Then third, painkillers, by the administration of painkillers as well as muscle relaxant. Then this conditions like for this bruxism and this clenching, we as dentists, because this causes severe issues, like this can cause limited mouth opening, it can cause frequent locking of the jaws, it can cause tingling sensation. Some patients do have tingling and numbness even in the fingers, because these muscles are all interrelated. So when one goes into strain, so this keeps automatically developing involving the other regions also. And and some patients also do ask me if malocclusion causes this tempero-mandibular disorder. Malocclusion is malalignment of the teeth, but until recent back research reveals no such interrelation between malocclusion and tempero-mandibular disorders. But presence of this impacted teeth definitely aggravates this tempero-mandibular disorder condition, because these impacted teeth will cause pressure on the joint while opening and closing of the mouth. And these muscles attached to the joint, these are the muscles which make the lower jaw move up and down, side to side, forward and backward. So, to be more precise, this lower jaw is the only movable jaw in the whole skull. So, and this function mainly depends on the proper harmony of the muscles. So, when the muscles are overstrained, then all these movements become bizarre. Okay? And so malocclusion doesn't play a role in this. That you should all know. Second, in severe cases of this clenching or grinding of teeth, we follow certain steps. We first tell the patients change in dietary pattern. That is, we advise the patient to take soft food for few days till the problem resolves. Then administration of these painkillers and this muscle relaxants, it will definitely release, it will bring down the inflammation of the joint, which slowly eases out the tension of the muscles attached to it, and this problem slowly resolves gradually. But in severe cases of this bruxism, patients do come with only 1 finger breadth or 2 finger breadth of mouth opening. See, one's normal mouth opening is 3 fingers kept in the vertical direction. So this is the normal mouth opening for each individual. As how they say, the size of the heart, be it right from infants or to a grown up, it is the size of one's fist. Similarly, so one's mouth opening, normal mouth opening is this 3 finger breadth. So I have seen patients with less than 1 or 2 fingers. So in such conditions, we make intraoral appliance. Only then we think of making this sort of appliances which would rectify these issues. Till then, this it can be maintained in a very with all these medications and all that. And the other problem related with this bruxism is main clicking of the sound. Clicking of the sound which is heard here when we open and close the mouth. This joint, the main function of this joint is to just glide smoothly and rotate back. So when this joint and the muscles are fine, these functions are carried out smoothly. But when there are issues, the patient will get this clicking or popping up of the joint. And this clicking of the joint may or may not be associated with pain. If it is without pain, we can just, it will slowly, gradually get resolved in course of time with this change in this dietary pattern and correction of their postures, then advising them of not to use chewing gums or not to bite this sharp objects, and this fermentations, painkiller, all this will slowly resolve the issues. But if the clicking sound is associated with pain, then slowly this mouth opening gets restricted, these muscles go into spasm one by one, and this causes severe migraine, like one side. See, if this joint is more affected than the other, this side they get frequent headaches, stress headaches. So then that is the time we make something called like mouth guards or night guards or occlusal splints. It is like this. These are a sort of intraoral appliances which is given as a habit breaking, to break the habit of clenching or the grinding of teeth. Yeah, this is soft one. Normally these splints, I can pass it around. This is not of any patient, this is just for the clinical study we just have in our clinic. Yeah. Normally, see, we make these splints for one of the jaw, right? But in severe patients or with persons involved in sports or other activities, we normally give splints for both the jaws. Now, what is the function of this splint? How does it help resolve this tempero-mandibular disorder? This, in common colloquial terms, this splint, when worn, This creates a space between the upper and the lower teeth. It prevents the upper and lower teeth making contact. So when this space is created, there is space between the joint and the capsule. So only when this space is there, with the help of our painkillers and muscle relaxant, the joint inflammation comes down gradually. When this joint inflammation comes down, the muscular tension or the muscular spasm slowly gets released, and then it falls back into its normal function. So I give this splint for patients to wear normally 4 to 4 weeks constant wear, 24/7. These are transparent splints. You can wear it for work, you can talk, but the only thing is to remove it while eating and drinking tea, coffee, because it can cause stains. Because these materials are not manufactured in India. This material, it is all imported material. So we educate the patients how to maintain this splint as clean as possible. That night is a compulsory wear for 6 to 8 weeks. Even after your problem eases out, even when you feel this clicking is stopped, even if your mouth opening is come back to the normal 3-finger breath, you shouldn't stop wearing this immediately. You should wear it minimum for at least 6 to 8 weeks. So, and then once the splint is made, you can have it safely, because as we say, this tempero-mandibular disorder or these issues, they are more related to stress, psychological factors and all that. So this can recur again. So when it recurs again, so by then you would have learned how to manage it. And from your point of view, how can a person know that they have this clenching habit? Self-analyzing whether you are biting your teeth. Sorry, because during sleep we don't know that whether we are grinding or grinding or biting of the teeth. So how to self-analyze? You might get up in the morning with a very dull, gnawing pain or soreness in this joint. That is the first symptom that the patient will feel. Like getting up, you'll have a tired sensation, tired feeling over here. Excuse me, please. Thank you. So this they have to evaluate first. Second, when they clench or grind the teeth, there will be indentations on the lateral borders of the tongue. When you put out your tongue and examine in the mirror, you will have indentations marked on the lateral borders of the tongue. Third, you will have a lot of wearing of the enamel, which is called as attrition. There will be generalized attrition of all the biting surfaces of the teeth. And I have seen patients, like when they give me history of biting some objects, the rate of attrition is more in the front, in the front 60. This we call as anterior segment. So in such cases, this wearing of enamel is more in the anterior segment. And then they might have frequent headaches, migraines. So these are all the factors which you can analyze yourself, that you are clenching your teeth. So normally these are all corrected, and if the problem is severe due to bruxism, we give this. But in case of this road traffic accidents or this blow to the joint, or when there is internal derangement within the joint or within the disc, only then surgical intervention comes. Surgical intervention procedures like arthroscopy, arthroplasty, is all done to correct or to bring the displaced disc into position. Okay, and I've just got a diagnostic questionnaire, so which I would give it to you all. I want you all to fill up so that we'll know about your, there are a few questions asked. She is my daughter, Dr. Chaturika. After filling up these forms, she will just brief you all how to differentiate the pain associated with the temporomandibular joint from the other neuralgic pain. She'll just brief you all regarding this. So kindly fill up this and give it to us.
Thank you, Dr. Sai.
Yeah.
As she rightly said, postures, stress, postures. You see, people they put high pillows. They sleep with the high pillows, so the neck is bent. That also causes too much of compression of this thing, and they develop the TMJ problems. Stress is the biggest thing. Some challenge children in the school, they have some fear, and then that builds up, or some sort of marital relationships, and there the stress builds up. People have anxiety of travels, and then that is the time. It's not a continuous pain all the time. It's like periodic. Some trigger has to be there to bring the pain out, and then you are in that cycle. How to come out of that cycle is what she has been explaining, put ice.
Conservative method and
The other things.
the appliances.
You can just do, but the best thing is put ice, that immediately relaxes. You have a person who has developed a TMJ problem is a lifelong TMJ problem person.
Yes.
It's not like you are out of it. Only thing is there are phases of pain, no pain, pain, no pain. But you will always be having one or the other time problem with your jaw. So that's the reason she was right. Keep your splints safe.
Yes.
You will require that space sometimes later, till and until the shape of your denture changes with age. You will still require it, but then it doesn't change so fast, so you can still
And I have also encountered students below the age of 15 to 18 years because of the study pressure, and they even while studying or going for tuition, they tend to clench, and I have really seen students with excessive pain, and before the board exams they have very limited mouth opening. So the parents have to see even that when you have children at that age, because and at that time we normally call them, because we don't want to waste their time. We call them immediately when they come with these issues. We make the impressions and just immediately give the splints, and with some painkiller for a week's time, then ask them to come after the board. But when they return to us after the board, I've seen tremendous. There is no crepitus, no clicking sound, everything is fine, and the mouth opening is sometimes beyond this 3-finger breadth. And also we should also educate the children and the elders in the mouth not to take large quantities of food, because you are again using, when you take large quantities of food and then try to masticate, so more stress is sent to the muscles. So to see it is always preferred to take small quantities of food. How can you give rest to the jaw? Not talking. Yes.
The more you keep your head flexed. Again, one more reason why you are having the TMJ issues more common these days is mobile.
Mobile, yeah, exactly. Yes, I forgot that point. She's correct.
And you develop the pace, because there's a constant compression happening at this level. You are going to be. So the best thing is somebody coming in that age bracket, so between the age of 15 to 40. They come up with the pace. The best thing is tell them, भैया social media से बाहर निकल जाओ.
No, Alpana, for that matter, I should say my mother-in-law is 82. She is now fully glued into mobile, YouTube, Facebook. Yeah. So that is what,
Octogenarians, septuagenarians are YouTube people.
Yes, exactly.
I don't know, and they see everything. Bhajan bhi dekhte hai, cooking bhi dekhte hai.
But although they might be wearing dentures, she is a denture wearer. But even you wear complete dentures, or even if you wear implant guided dentures, again you tend to clench your teeth. So this problem will be lifelong. So we should really learn how to manage this joint. The joint is very, very, very crucial. So this should be maintained in harmony with the muscles attached to it.
So there must be some exercises or relaxation.
Yeah, that is Dr. Alpana's, the jaw strengthening exercises. That part, she is the right person to talk. Yeah, relaxation.
One of our staff today, unfortunately, she is not there. Some family issues. She has TMJ problems. But it is just like, morning she'll get up and locked.
Yeah.
She's not able to open the mouth. Her mouth hardly opens half a centimeter. And then there's nothing which she can do. It was once on one side, then after some few years it developed on the other side. She has to go put a injection, a steroid.
Yeah, we used to give hydrocortisone, steroid injections.
And then it opens up, she comes back. So she was the inspiration to start the session. Like that, it's like because most of the times I'm seeing children, young children coming up because of this mobile.
Yeah.
That COVID brought in a lot of unwanted things in
Issues,
everybody's
yes.
life.
Yes.
ऑनलाइन के नाम पर दुनिया का बंटाधार हो गया है. Please come, Chaturika.
There is no screen time for the children.
She has just completed her BDS,
Yeah.
got admission for MDS. So she is like, helping her mom after her this thing. She is helping her mom in the clinic doing this. And she is going to talk about how do we differentiate whether this pain is coming from TMJ or it is something else. Yes, please.
Hello, good evening. So, I think it is very important when it comes to health, there's only one motto, it is better to be safe than sorry. So, say for example, you have a TMD and you're having pain, okay, and because of TMD, like she said, you have various symptoms like headache, pain in the facial region, neck region, and ear pain. But for example, your headache or your ear pain or any other symptom can also, they are characteristic only to the TMD. They can also arise due to various other medical reasons. So it is important that we should know how to differentiate the type of pain so that we don't confuse it. Because you have a headache due to some other reason and you are thinking, oh, it's probably because I have a TMD, I'm wearing my splint, so I shouldn't worry about it. But what if it is because of some other reason? Then you're misdiagnosing it, right? You're missing something important that will help in preventing any further medical complication. So that's what I am here to talk about, to tell you how to differentiate it. So when it comes to the pain in your face or the neck, we have different type of neuralgias. I'm not going to go very much into the scientific terms, but all these different type of neuralgias and the pain in TMD are not the same. That is what we need to know. Like for example, when it comes to TMD, the kind of pain you will have will be a dull type of pain. But when it comes to these neuralgias, the pain will never be dull. In most cases, you will have a sharp lightning bolt kind of pain. It will just spread through your face. And in some cases, in the facial pain, apart from TMDs, you will have these trigger zones. That is when you are smiling or laughing, or even when a tiny gust of wind is hitting your face, you will have pain. But all of this will not happen in case of TMD. TMD, the pain will increase when you are biting or clenching your jaws, and it is usually accompanied with other symptoms like the clicking noises, etc. Whereas the clicking noise will obviously not be there when the pain is due to other reasons. And say you have headache. How many of you have migraines here? So, ma'am, you will know that migraine, it's a very difficult thing, and so many people with migraines, they have this thing called auras. Half their vision sometimes will go, like for a long period of time, it comes back, it's temporary phase. So all that will not be there in the headache that comes due to TMD. Each headache is different, each facial pain is different. So it is important that we know how to differentiate it. So we can't think, oh, it's probably because of this, and we can't just let it go. And one more thing is, I want you all to just follow what I'm saying, because I want you to know what is the proper bite. So each person has a different bite. The bite isn't like characteristic for, I mean it is characteristic for every person. But because of this, many people, they tend to think that their bite is right. But a lot of patients we come across in everyday life, their bite is not right. And because of this, various problems, be it dental also and TMDs also, will tend to arise. So I'll tell you how to know if your bite is proper or not. So if you all can swallow, if you all can do it with me, it will be easier. So if you all swallow, and immediately after swallowing, there will be a phase where your upper and lower teeth come in contact. Immediately after swallowing. Right? Can you all feel that? That particular thing is your bite. So if that's how you're biting normally, then well and good. If not, then you need...
What is normal there? Yeah. Okay, I swallow. After swallow, I know they have come in contact. Now, how do I know that is normal or not normal?
If it comes in contact immediately after swallowing, that is normal.
Okay. It has to come in contact. The upper and the lower on the back needs to come in contact exactly one over the other.
Yeah.
If that is happening, it's a normal bite. If that's not happening, it is an abnormal bite. आप आ गए नंबर में लगा दिया इनका नंबर लगा दिया.
So when you said soon after swallowing, the upper and lower teeth touch each other. Now, okay, they have touched. Should we make a movement in the teeth to find out whether they're exactly on top of each other?
No, if you move and then bite, then it is not a normal bite.
No, after that. What I'm saying is I have swallowed and my teeth have. What should I do with this? Just hold it. Okay. So, so my teeth have come in contact with each other, face or jaw or anything. But however, I do have a feeling in my ear, in my left ear. So there's a kind of a prick. It comes and goes. It's not intense. It's very mild. So that is the reason today I came. I thought it could be connected to TMJ. So is it connected to TMJ? It could be.
As I said, this pain in the ear or any discomfort in the ear without any ear infection,
Yeah.
then it is because of
TMJ. Okay.
all these muscles are
Also on some days when I have the feeling here, this part of the face becomes sensitive, the skin becomes sensitive, my scalp becomes sensitive, and for no reason, and without, it's not sensitive to, I just feel it's sensitive. Like when I touch, I know it's kind of irritated. My skin is irritated without having used any products. It's got nothing to do external. But whenever that pain in my ear comes, this happens. So
no, this is also another example. This is what we call as atypical facial pain.
Okay.
Related to this. So then you will learn to wear it the next day or that night itself. So in such cases, wearing it before, in course of 3 to 4 weeks, this will gradually settle down. And not only mainly because of this pain, you should also concentrate on your correct posture. That is what I want to emphasize with ladies especially, because this is more relevant with ladies. And see, more than 85 to 90% of our population have this tempero-mandibular disorders, but they are not aware. When they get headache, they go and meet neurologists. They have been advised CT scan, MRI scan. Then they go and meet the ENT, and last and the least they come back to us. By then the problem is so severe, which leads to very restricted mouth opening and pain. They are not able to eat. They like sensitivity of the teeth. So, see, if we encounter this patient at a very earlier stage, just conservative treatment, even the splints will not be needed. This conservative management is sufficient. But as the severity goes, only then this sort of the intraoral proposal splints have to be. But especially for sports activity people, giving splints for one jaw is not enough. Because when they are engrossed in that acute activity, they tend to clench. And I have seen such persons who have perforated the splints. So that much of pressure they bite. So in such patients, I definitely give splints for both the jaws. That is to wear when they are into active sports activity. And at night they can wear just one splint. Does taking magnesium help?
Sorry,
I'm sorry. Does taking magnesium help this?
No, ma'am. Taking magnesium
Doesn't help this.
But normally, as you say, see, even systemic conditions like osteoarthritis, rheumatoid arthritis, all causes this joint also. And for which, persons like Dr. Alpana would have, they will teach you how to
Maintain.
how to maintain that. And just painkillers and muscle relaxant. But lack of magnesium
Will never cause
it
this.
will not cause. Not at all.
Thank you.
Yes, ma'am. You had to say?
Yeah, you recommend the usage of the splint 24/7.
That is when the problems get acute. Acute in the sense,
Yeah.
when there is, this dull, gnawing pain will be there.
My problem is I don't have any pain, but in the morning my jaw cracks so badly every morning that I have to actually hold this, and chew gently. So would you recommend a 24/7 splint, which I do have?
When you have this sort of acute symptoms, when the symptoms are acute, then definitely at least for 4 weeks, constant wear
24/7.
really makes a tremendous result.
And you think tinnitus is connected?
At night time.
You think tinnitus is connected to a TMJ disorder always? Yeah, okay.
But during night, see, all through the day we are constantly talking, eating, chewing. So we are constantly giving work to the muscles and the joint. So at night, definitely this temporomandibular joint should be given rest.
Rest.
So this will prevent its recurrence.
Okay, I'll write it right. Thank you.
How is posture related?
Yeah. And yeah. See, how did I go to meet Dr. Aram 20 years back? Being a dentist, and see almost all the occupational people, they do have this occupational hazards, which causes even like people working in IT, and so all, and students also like studying, like continuing, and during exam they just bend and keep studying. So all this process, it first starts, see in such cases, it starts with pain in the cervical part of the spine. Then it radiates to the temporomandibular joint because all the muscles are attached here. So even when you develop cervical spondylitis or spondylosis, this can also slowly come to this joint.
So it's mainly because the neck is bent forward, is bent down, or there could be other bad postural.
It could be because of the small posture.
Okay.
Pain in the neck is because of the improper positioning of the
Neck.
Yeah.
Okay.
So in that case, slowly it will also get involved with the TM joint.
Got it.
And as you say, if you are self-analyzing yourselves, as Madam said, you might, you might not get up very fresh. You will have a soreness or some sort of tightening in this region when you get up. So these are all signs which shows that this joint and the muscles are getting affected. So this all of you should be aware.
True.
What happens is when you have a TMJ pain, and when there is a pain there, any pain, we'll always try to take a position where we don't feel the pain. So when this pain is there, without your knowledge, automatically you adopt this posture. This opens up and you feel better. But then with this, then gradually your neck starts hurting. When you come up with a neck pain, you still don't realize this was the cause of it. It's only later then the diagnosis happens that okay, you started your neck pain because of this. It was not primary neck problem. So your posture. So one is this bending that causes a compression. So it is like your neck posture giving rise to TMJ issue. Your TMJ giving rise to this neck and this neck problem. Yes.
Okay.
So
Thank you.
Exercises, doctor. Exercises for TMJ. Yes, very good. Anything else you want to add? Done? Anyone? Anything? What is there in this question as?
If they have pain, and if they have pain, when does it occur and how severe the pain is?
Okay. So how many of you had pain in and around the jaw? 1, 2,
Very mild pain, I think, like
3,
your mild.
4, 5.
That is because of prolonged mouth opening and
Actually, my problem also started after I got my root canal.
oh my God, people are blaming us.
No,
No, but nowadays root canal, it's also advanced. We have more sophisticated instruments, even root canal molars, not more than 20 minutes.
That is not the problem. The problem is the dentist, they want to reach. yes. They keep on pushing your neck, they keep on pushing their hand inside without realizing where is your neck going. That is the problem. So I keep saying, I said, why don't you lower the table or you do something, make it in such a position where you have an easy view and They keep, for their view, they'll keep moving
No,
your
in
head.
case of lower teeth, it's fine, we just bring them in this semi-declined position. But in case of the upper teeth, because the doctors mostly work with the indirect vision correct with. So we have to strain. So in
Only
such
two
cases, this
people,
can occur.
those who are new entrants, they do it, or those who are very much experienced into the field, they feel I can just move one and it will be fast, so they just do it. But then that itself becomes so much for the patient.
That these splints are very comfortable in treating these.
Yes,
Say
very
for
true.
15-20 years, I have taken my patients to my say oral surgeon and in a MOT, in a mini operation theatre, then we just give them hydrocortisone steroids into the joint. So, but now with these splints, it really, see, if the patients follow the advice of us, it really settles down.
It helps, it helps.
It helps.
I've seen with my daughter, I've seen with my nephew. This thing, it helps. With a lot of our patients, when they come up with the pain, they themselves don't know that they are grinding the teeth. And the earliest sign that we understand is asymmetry of the face. एक बाजू में बराबर से कुछ तो गड़बड़ है. It's like
And the
that
other
is very
reason,
sensitive.
sorry, another reason for developing of this TM joint is making one side more functional. See, that I've seen in
True.
most of the 80% of my patients. They always say, no, I only bite on the left side, madam, I don't use the right side. So making one side more functional and keeping the other non-functional, this causes more of this TM joint issues on that side. So you should concentrate when you chew and eat. You should be aware that you chew food on both the sides.
Both
So these are
sides.
the factors which just which can help in prevention of these disorders.
Okay.
So I'm really happy that I hope that I have also
It was really
you have
good.
just understood about the tempero-mandibular joint and the disorders related to this. So please try to see, self-analysis is very important. Before you come and meet us, you have to analyze yourself. Just don't take it with your very busy schedule. Just don't take any signs shown very light. So if these signs are shown, say for more than a week, then it is better you see a doctor. Okay. Thank you so much.
Thank you. Welcome. My pleasure. Thank you. So we'll just talk about a few of the exercises. As a occlusion ka, one thing is when you're opening the mouth, when is it? Like opening is the deviation during the opening and closing.
You asked me when the deviation will occur.
Yeah.
So most patients that I've seen is when they close in the improper way. They deviate. You're supposed to open and close straight. It has to be straight. Some people they bring it to the left or the right side and then they bring it to the correct position. They don't close improperly. The part in which they make their jaws close are improper. Because
But all those things, nobody in this thing, nobody is intentionally doing, no, you're not conscious.
It's not
automatically.
Yeah,
it could be some muscular, like.
Correct.
See, those are sort of say involuntary.
Yes,
See, when you open this lower jaw, it is supposed to glide back and rotate back smoothly. But when this joint is affected, see, you will not see when you are opening your mouth. But when you take your jaw back, there is a deviation of the joint. And whichever side the disorder is more, the jaw deviates and goes back. So this you can just stand before the mirror and see. And in case of this clicking sound, just place your index finger.
That everybody can do it. Do that test.
Yeah, in front of this ear.
You have the test, no? You put in slowly open and close.
Yeah, here.
we
This
should
region.
hold it like this and make it open and close.
No, self they can do, no?
So you
Put
can
the
slowly
little fingers inside the ear,
Just like this in front of the pinna and then we can.
not inside the ear.
Then we don't. Then mentally we suggest them to do
No, that is going back.
Okay, that you will keep.
Hold of the jaw.
Will
So
they
if
self.
yourself,
Yeah,
so just
it is
in
normal. You can feel this jaw
Inside the ear.
going back normally into the socket. But if this
I don't know, I
joint
read
is
that.
inflamed,
Okay.
the patient themselves can see when they stand before the mirror and do. They can see this deviation when they close.
Yes, you can do it yourself. Keep your hands in front of the ear Just two fingers, just this, lightly, not to press. Just keep it there, keep your mouth and very slowly open the mouth and see where you feel the thrust happening or something out coming and touching. If both the sides are same, it is good.
Yeah, do you feel any clicking sound?
The clicking will be later. What we see is the deviation, like the speed at which the rolling is happening. That itself is the first thing they will be noticing. You can feel as if it is like one has rolled faster, one has gone slow, or it's something is coming out on one side. Both going same, no problem, everything good. Changa hai ji. सही है, perfect. Yourself, अरे वाह. Yours?
सही, perfect.
Huh?
You know, doctor, when I'm applying it, it eases.
छोड़ो, छोड़ो.
Becomes lesser and lesser.
Open, close.
This is the
Open, close. Chatu, you can just check it out for everybody. Open, close, open, close, open, close. This side. हाँ, इधर hypermobile है, ये कम move होता है. So the stiffness is there. Even your face, this side is little like this. This is proper. There's the stiffness on this side. So exercises, TMJ exercises, simple, very simple to do, better to do in front of the mirror, so you know what is happening. You have to very slowly, this is the midline of the upper one, this is the midline of the lower one, right? Slowly open the mouth, ensuring that upper and the lower, they remain in line and slowly it's opening up. So वो थोड़ा भी right में जाएगा, left में जाएगा, bring it back, bring it in the neutral position. And slowly close it again. While closing again you have to see it's not going right or left, it's going straight towards the midline of the upper jaw. So up, slow opening, maximum 3 to 4 fingers. This is the maximum. That much you open and then slowly close it. Now, those who have got some issues with the joint, either it is a hypermobile joint or it is a stiff joint, don't open to the full. Open till you feel that it is not deviating. The moment it goes beyond that, it will deviate. Stop there and continue to do the movement there. Slowly your range will increase and you can go. Exercise. That's what I'm saying. So you're opening, suppose you have opened this, and now after that you find this is opening like this. So you don't have to continue opening there. You try to see that you're opening and you try to hold this on side and still open to the maximum where you can hold it in place. Where you feel now it's not, it is still deviating, stop there. From there you need to come back. Hello Maya, please come. Hi. Okay. Next is your right and left. The jaw from the midline move towards the
Side to side.
but don't move it like a pendulum. नहीं करना, पूरा चला जाएगा. Okay. No, you know what? People can do that, so I have to make a point to say everything.
ಏನು ನೀವು ಬಂದದ್ದು ಕಸ್ಟಮರ್ ಕಾ
I don't want to do. Okay, right, left, and both the sides it should be equal. Whichever side is less, try to make more efforts to push towards that particular side without. Now, those who have got a stiffness, how they do it? Let me say I've got a stiffness on my right side. So this moving towards the right is not enough. What I'll do? वैसा नहीं करना. Okay? It has to be just only the jaw, not your neck and face and everything. Nothing doing. That is 2. The third is front and back. Push your lower jaw out in front and pull back. Yes, slowly out, in, 3 exercises, 3 directional movements of the TMJ helps in maintaining a good this thing. Unnecessarily do not do. Again, I'll add a word of caution. You don't have a, no. This is not an exercise to be done as prevention. This is no preventive exercise, this is curative.
Yes.
You have a pain, you have a problem, do it. You don't have anything, please don't disturb it.
Yes.
Yes.
So there's nothing to do.
नहीं करना.
Doing these things.
Then you will come back saying, अल्पना तुम बोले तो मुझे मेरा दुख रहा है अभी. No, Veena will tell me also. You made nothing. You gave me pain. अब कुछ भी करो, लो. This is Veena. Yes. So yes, that's it. I think that only 3 exercises, nothing else to do with it.
The neck you all said because neck posture also can affect, right?
Just avoid looking down. Avoid looking down constantly. वो like sitting में वो phone पकड़ के जो बैठे रहते हैं ना, that's the biggest culprit. At least hold it like this, keep it straight. आजकल तो इतना अच्छा phone stands आता है, बेचारा उनका भी बिक्री कर दो थोड़ा सा. Use that is better. Don't this thing. Otherwise it doesn't. Neck problems come mainly. The neck leading to TMJ is this or high pillows. There are people that like 2 pillow, 3 pillow के बिना they are not able to sleep, and the reason they say is snoring होता है करके. Those who snore a lot.
Asthmatic breathing patients, they tend to sleep in almost with 2 pillows or a semi pillow.
Instead of going in for those pillows, it's better to use a wedge pillow. You get wedge pillows. Your head remains. You're elevating your complete body up from here coming missing, huh?
Hospital में रहता है मैं.
Wedge pillows coming in the shape of a wedge. You get pillows coming in shape of wedge itself. So just wedge, and they come in different heights. You get it like 6 inches, 10 inches, मिलता है अलग-अलग इसमें. How you want to take people with GRD issues like reflux disorders or asthmatics or those who have snoring, sleep apneas, good for them to use wedge pillows instead of keeping 2-3 pillows and landing up with other problems. So that's it. We cover up everything. Anything else which you feel is left out or you feel this is the query to be attended? Thank you so much. Thanks for your time.
Thanks a lot. And thank you, Alpana, for giving me this opportunity.
We are always
and my pleasure to see such lovely people here.
So a small memento to Dr. Sailakshmi from Total Rehab.
Thank you.
Thank you very much. Thank you, Dr. Sailakshmi, for your time. Thank you, Chaturika.